Well, shortly after my children were diagnosed, I was given the name of another patient named Mark Freedman. He had asked our physician that if any newly diagnosed families came up that he would like to be put in touch with them. So I was given the number, and I called Mark and had a very lengthy phone call with him, and it was so great to reach out and finally meet another patient, I had so many questions for him. Mark Freedman informed us that he'd been in touch with several other patients and that he was trying to get a meeting together so that we could discuss forming a group to support Gaucher patients. From that meeting with Mark, we were able to meet other Gaucher patients, and from that grew the National Gaucher Foundation of Canada. We would have fundraisers and stuff to bring the community together, and we were able to have patients attend annual meetings, which was a great resource because people are isolated with this disease. So that was another really big achievement for us, to be able to bring patients from across the country together in one room, and from that small group of 5 people, many people kind of grew out of that. About 6 or 7 years ago, Mark's life was very busy, and there were other things happening in his life, so he asked if I would be interested in taking over the role that he had played over the years, and so I was very fortunate enough to have him mentor me for a couple of years as a president, and every decision I made I ran by Mark, and he really taught me a lot. And unfortunately, a couple of years into my mentorship with him, Mark's health took a turn for the worse, and he died 3 years ago at the age of 55. My current role is president of the NGF. We have a 6-member board representation from across Canada. Our mission is to provide support for patients through communication, through advocacy, through research, and through awareness. We like to reach out to people. This is such a rare disease that it can be extremely isolating. I've personally experienced that when my children were newly diagnosed. So to be there for other patients and to be able to support them through our work is really important to us. And that's one of our primary goals, we don't ever want people to feel like they're alone.